Hi, I'm Dr. Castanet. I'm going to talk to you today about degenerative disc disease. I've talked about this or made allusion to it when I talked about what causes neck and back pain generally. And it is this degenerative disc disease process that subsequently gives rise to other degenerative changes in the spine, including to the joints and ligaments, etc. I'm going to use a model to explain some of this. This is a model of lumbar spine. You're familiar with this. I've used this before. This would be the front of the spine. This is the back of the spine. These spinous processes are what you would feel if you ran your finger down the midline of someone's spine. In between each of these vertebrae, and this is in the low back, but a lot of this anatomy and a lot of what I say pertains to the neck as well. In the low back, you have vertebrae and you have discs in between. The discs are really what triggers the whole degenerative process. The rate of degeneration is a function of lots of things, and we can't apportion or quantify the extent to which these, I would say largely three contributors or factors contribute to the rate of degeneration, but they would include your nutritional status, your genetics, and the physical demands over the course of your lifetime. The physical demands can be readily well tolerated if, arguably, if the genetic and nutritional status of you was good. The nutritional status is a little hard to argue. We don't know a whole lot about that. And what we do know about it is not widely disseminated or appreciated. But and it's a topic I'm a little reluctant to broach because there is not a consensus about this among healthcare providers, and most of them don't discuss this at all. But you know, that's true of medicine generally. They pay lip service to things like you know, your nutritional status, but and then they define it in terms that I would argue are fallacious. But I don't want to go down that path too much. So anyway, suffice to say that the rate of degeneration is a function of your nutritional status, your genetics, and physical loads, environmental loads over the course of your lifetime. And it starts as children, but it's not appreciable as children because degeneration generally starts in the center of the disc, and it's only the outer fibers of the disc that are innervated. So it's only till the degenerative process progresses to involve the periphery of the disc fibers that you begin to feel pain in the back and associated with the degeneration. When I say degeneration, let me tell you, generally the disc is made up of two components. The first is very tough rings of tough fibrous tissue that are oriented at oblique angle, and then there's another layer oriented like that, and so on, so that given the 12 to 25 layers that exist, depending on where you are in the spine, they make a very tough containing basket, so to speak. In the center, the consistency slowly changes to be more like a crab meat that imbibes or absorbs water and then releases water during the course of the day with axial loads. The purpose of that inner component is to imbibe water at night when you're non-weight bearing and resting, and then you get upright, and then the axial loads on the disc encourage the this, let's call it a wet sponge, to distribute the load of the water hydraulically against the walls of the outer disc material. Over time, the outer layers do degenerate, and degeneration progresses and aggregates and increases so that eventually it weakens the walls of the disc sufficient to allow the inner material, which is under pressure, to bulge out and sometimes herniate through tears in the outer disc. Then it can pinch nerves. When it first starts to involve the outer fibers, you'll have just local back pain. As it progresses to involve some of the nerve root. Initially, the pain will radiate to the buttock region and the back of the thigh, and then it can radiate all the way down to the foot where these nerves run in the low back. In terms of the treatment and what you can do to improve the status of your back over the short and long term, there are two things you can do. Because this is a compressive process as we get older, and this degenerates and it collapses as it loses water content. In the way of intervention passively, the best, most effective treatment is to decompress the spine, or to reverse the compressive nature of this process. So to do that, I put a person on a table. And I've explained this at length in other videos, because this is the way to treat most back problems, including acute pain in the context of a degenerative process, which is what we're all undergoing, and that's a safe assumption to make when you're treating anybody that's, say, 30 years old or older. So decompressing it is the most effective means to intervene in this process. In terms of what you can do on your own, and only you can do, strengthening the structure is highly valuable. When you strengthen the structure, you will improve the posture of your spine throughout the course of your day, because strengthening all the muscles and ligaments and bones and cartilage and all the tissues that will benefit from a strengthening program, by doing that, they will maintain the spine in a better position, both passively when you're sitting and doing nothing, and actively when you are doing something physically demanding. There's also another little component that I should add, and that is that you need to learn some biomechanics and some ergonomic facts, so that in the course of your day, when you are dependent on your spine during physical activities, that you do them in such a way that's biomechanically the soundest and safest. If you do that and you're knowledgeable about that, you can handle extremely heavy loads on the spine, as any weightlifter or power lifter could attest, and you can see yourself. You can handle many, many hundreds of pounds done the right way. And of course, these guys that develop great strength in the spine also have greater capacity for functional loading without injury. And so let's get to the active component that only you can do to improve the status of your spine, and that is strengthening. It's common for doctors and physical therapists to recommend strengthening, but I think there are very few methods to do it that are in a meaningful way that will translate to significant improvements in your spine status over the course of your lifetime, including reducing your risk of injury. And I would argue that it's not going to be from simple physical therapy exercises where they have you do Superman exercises where you extend a leg and an arm, etc. Those are fairly modest and not particularly meaningful in the way of gaining strength. The better way, albeit more demanding recommendation for you, is to have you do deadlifting ideally. That's number one, if your structure can handle it, and most can, although you're going to be hard-pressed to find a professional, a medical professional, that will recommend it or have any knowledge in the way of advising you how to go about it, in part because very few have any personal experience doing it. And then secondly, professionally, we don't learn those things professionally. Even as spine specialists, we don't learn how to effectively strengthen spines, and nor are we encouraged to encourage patients to do something like that. And because that information and expertise is outside our wheelhouse, we generally just tell people to walk as a means of exercise, or do simple exercises that are not likely to harm them, are not very demanding, but are also not likely to be very meaningful as an intervention over the long term. You can find out more information about deadlifting by going online and checking out YouTube channels like Barbell Medicine or Alan Thrall, or there's a host of others I'll mention another time, but those are two very good. Starting Strength is another good one. Starting Strength is a good channel because that channel also has anecdotes and testimonials from people that are older and disabled in a variety of ways that have taken up weightlifting and squatting and bench pressing and overhead pressing as a means to improve their physical status with results that will, I think, blow your mind away. They have women there that are in their 60s. In fact, I went to one of their seminars a couple of years ago, and in my class where we learned how to squat and deadlift, there was a 65-year-old woman who had been doing the program, and she did 5 repetitions of a deadlift with 245 pounds. She looked like any 65-year-old woman, but obviously her hips, thighs, and back were exceptionally strong. That's the sort of intervention that makes a real difference. But again, you're not going to find it commonly recommended by doctors who know very little personally or professionally about weight training or about how to strengthen a spine. And that's true for physical therapists and chiropractors as well. You have to have a personal interest and gain knowledge outside of your profession to make this sort of recommendation. But I'm comfortable doing that because for personal and professional reasons, I know a good deal about that personally, and have seen so many people benefit from deadlifting specifically for low back pain. Apart from that, you can try Roman chair exercises. You may see these at the gym. Some of them are oriented like this, where you suspend, if the Roman chair is at this angle, you suspend your upper body here and your lower body down here, and then you lower your trunk and raise your trunk. And that works the extensors of the back right here. You would be face down in this position, right? Bending down and coming back up. You can definitely get some benefit from that, and you might prefer that as a means of treatment. It's certainly easier if you don't have access to a gym, although at a gym, deadlifting is pretty easy. And you can start very light and work your way up as you do on any exercise. So for more information about the deadlifting, go to those 3 YouTube channels, Barbell Medicine, Alan Thrall, or Starting Strength. For the Roman chair exercises, you probably can Google that and find something like that on YouTube. YouTube, by the way, is a great source for learning about these weight training things, including the channels I mentioned. If I can help you with the passive treatment of your back pain when you have an acute episode, with decompressive treatment, which is the treatment I most recommend for neck and back pain in the short term for painful episodes, let me know. I'm Dr. Castanet in Decatur, Georgia. My phone number is 404-558-4015. Thanks. Bye-bye.